Hi everyone, and welcome to the Women's Health Research Translation and Impact Network's Indigenous Subcommittee's webinar on the topic of collaborative health research with Indigenous women. My name is Kai Wilkie and I'm a Ngarrindjeri woman from South Australia, and I'm the webinar facilitator for today. Before we go any further, I'd like to acknowledge that I'm currently living and working on Bidjigal land, and that I'd like to pay my respects to elders past and present, and recognise that our ancestors and elders have fought so hard for all of us to even be here today. Just some housekeeping before I introduce our lovely panelists. Please put any questions throughout the presentations in the Q&A, and we shall do our best to answer as many questions as we can at the end of the presentations. Anything else, you are welcome to put in the chat, only nice things and not swear words and things like that. The webinar is being recorded and will be uploaded to our YouTube channel within the week. I'll put the link to our YouTube channel in the chat for reference. Also, upon closing the webinar, there'll be a link to our survey to evaluate the webinar, which should pop up. Could you pretty please complete the survey, because that would be really wonderful and your feedback will really help us improve future webinars. So with us today, we have Mary Warrior and Professor Arnie Carey-Doyle. Mary Warrior is a descendant of the Aragon tribe of Badu Island in the Torres Strait. Mary has worked since she left school at 18 in both private and government organisations. Over the last 20 years, Mary has been in higher education institutions as a student engagement and support officer for both Indigenous and non-Indigenous students. Mary has lived in a few different cities, including Brisbane, Sydney, and Darwin, and is now back in Queensland. In Brisbane, where Mary works at the University of Queensland as an Indigenous Higher Degrees Administration Officer, where she coordinates activities, workshops, and meetups for Indigenous higher degree research students. Arnie Carey is also here with us today. Professor Arnie Carey is the Associate Dean of Indigenous Health in Western Sydney University School of Medicine. Arnie Carey is a Winnenini, Gadigal and Irish woman, and she is also the Chair and Research Lead of the Aboriginal Health and Wellbeing Clinical Academic Group at Murrajulu Budjari Gumul, which is also known as the Sydney Partnership for Health Education, Research and Enterprise. So Mary, would you like to present first today? I will I'll just share my screen for you. And hopefully you can go ahead when you're ready.
That's it. Awesome, thank you. So before I start, I'll acknowledge the Yarragal Turrbal people here in Brisbane. So my screen there, you can see, basically it's a story of my life, a short story, the short version. I was born in Torres Strait, the beautiful island there of Badu, to the Aragon tribe. At the age of 10, my family moved to Brisbane, and I went to school there, primary school, and I finished high school at grade 12. So the second picture is a picture of Brisbane in the 70s, mid-70s. And then I went on and I worked in lots of different areas. And then I eventually, in the last 10 years, I worked at the University of Sydney, down in Sydney, as a student engagement officer. And then I went on to, came back to Queensland after COVID hit Sydney and everything was closing down there. My contract finished at the University of Sydney. So I came back up to Brisbane to stay with my family and ended up getting a job at University of Queensland. And the position I have here is a brand new position that the university's graduate school has created, and I'm the first person who's been in this position. And it helps me because of all the experience that I've had within a university environment. It brings with me, I bring that with me to work in this position. And already in a year and a half, I've seen a lot of change happening here with no acknowledgement of Indigenous people, because I'm within this area that really hasn't seen a lot of Indigenous faces. We have 65 Indigenous students doing their higher degree research papers at the moment. But that's just a brief introduction to me. What I want to talk about is my experiences within a medical centre environment, and what sort of makes it work for me, why I find, some places better than others, and how I feel being treated in these places as a member of the public. Well, I can, because I consider myself a member of the public. In most recent times, say in the last 10 years, when I went to Sydney, I had some health issues when I started work at the University of Sydney, and they had a medical centre there. The oldest doctor who was the head of that medical centre took me on, and he, just helped me because my diabetes wasn't in a good place at the time. My sugar levels were really high. And he took me and referred me to amazing sort of associated clinics. Example, university's right close to there's a hospital just up the road at Darling, at Women's Hospital, Royal Sydney Women's Hospital. So there was facilities I could use there. They had a diabetes centre, they had a women's centre. I could go and get my breast screening and all of those types of things. They also had a podiatry office that I was linked into, so I could go and get my feet checked every month. And then one thing that did happen was that I had problems with my eye, and I was it felt like it was like I was in there at the right time. Something happened to my eye. I was able to talk to an ophthalmologist immediately, who was able to book me in, schedule me in for an operation within a week, and it didn't cost me anything. I went through the private public system, which, if I was going to do that, if I did that privately, it would have been like $5,000 to $6,000. So just incredible care from all of these people that I came across over my 9 years in Sydney at the time, because I was working in this place that was convenient to all of those, and the people were very welcoming. They looked after me because of my health issue, not because of who I was. So this was in a non-Indigenous medical centre. So it was just so nice to have people look after me, just because I was a person who had a medical problem, not because of who I was. When I came back to Brisbane, I went to the Indigenous Medical Centre here, and they have Indigenous staff who do the prepping for the doctor, and all of that, a 15-minute assessment, people talking to you about your family and things like that, because that's what Indigenous people do and how we spend our time getting to know each other and getting comfortable. And that was exactly what this Indigenousness and I connected, and I felt comfortable, and that was fine. But when I went in to see the doctor, he was not an Indigenous doctor, or not an Australian doctor, and he did not listen to a word I said, and he did not take any care in anything that I had said to him. I brought with me my last 7-8 years of medical history on a CD. Didn't want to have a look at it, didn't have a way to do that, didn't even think about it. He didn't even sort of go, okay, I'll go and talk to my nurses or somebody at the front desk if they can do this, and run your diagnoses or some reports for me and print it out and so I can put it on file. There was just no care, to the point where I've not gone back to that health centre since, because I felt like I was not being treated like a person, like somebody, you know, everyone's different. Everybody comes to these places and you expect to be treated because of your ailments, your you're there as a, you're there because you have a medical problem and you want to you want someone to give you, you know, details and how to fix that, etc. So I've never been back to that medical centre, and I've actually not found one yet that has been that I feel comfortable as yet. So I've been here a year and a half, and I've, you know, I really need to, I'm looking at trying to find somewhere. You have to keep going and looking and looking. When I went home to the Torres Straits a year or two ago when COVID was starting to kick in Queensland, and I just got there in time, and we were up there for Christmas. And I had the most awesome experience of being, I went for a really simple COVID injection, and one of my nieces was part of the medical team, and she rang me and she said, Auntie Mary, go down the road because we're coming down there to have a pop-up clinic for vaccines. So I just walked around the corner, and it was just an amazing experience to have all the staff and the nurses be all from the islands, and they, you know, respectfully, like they didn't, because I was on Thursday Island, a lot of them, I've only been there a couple of times, so a lot of the people I don't know, but they all respectfully called me auntie, and, you know, making sure I was okay the whole time that I was there, and I was only there to get an injection for COVID. Amazing to see. But I do know there is a few issues there with our medical staff not being given the respect from non-Indigenous doctors or non-Indigenous medical staff. It's like they treat us like second-class citizens up there. I can see it, and I know it from people that I've spoken to. But you know, a lot of our Torres Strait people have been in those jobs on the island for like over 20 years, and they're not given, you know, positions that are more senior, even though they are now more senior people and have the experience to do those jobs or to be recognised as a, you know, manager of an area or something like that. So there's a few little things that you can see that could change. What I would really love is that doesn't matter where you go, what, you know, what colour you are or the doctor is, that you're treated amicably and with just with the respect as a doctor, as somebody who's going to see a doctor or a GP or a nurse. I'm just can you see that message there, Kaya?
Yep, sorry, it's just.
Yeah, don't worry about it. It's just
It's
something.
on, Carrie, yeah.
It's
Okay.
it's me.
Okay.
Keep going, sorry.
No, that's all right. So yeah, I think I'm actually at the end of my conversation. If we want to go to you, Kerry, I'm happy for that to happen. You know, I can mute myself.
Oh, I was hoping to hear more about your experiences.
I'm thinking. Yeah, no, those were the only three situations that really sticked in my mind, that are things that I would like to, and I can imagine that I've had this experience, and I can imagine that people in, you know, like communities could possibly have a similar experience. I mean, I lived in Bundaberg, in Darwin for five years. I worked up there, and coming from outside of that community, but because there's a lot of Indigenous people up that way, I went to the medical centre. It was all like accepting, like they didn't, I was going to say they just don't look at you and go, oh, you're from somewhere else. No, it was all acceptance. It was part of my job to deal with all of the allied health centres in Darwin. But when I had to go and utilise those places, we had the understanding of the doctors, and I guess that's where I'm coming down to, is like, it's not only just, you don't just learn about Indigenous culture from cultural awareness courses. You do that being involved, talking to people, being on the front line, seeing that people are just not what you think of a black fella. Everybody's not the same. So everyone's has a different life history, and everybody's been in different situations. And, I've grown up very middle class white. So I've, learned how to not be white, but learnt the situations and to judge situations and, dress accordingly, go to things. And so it's different when you see people who come into town from communities who don't know, because they don't know, they don't live in these places, and you don't judge those people from those things they wear or by the way they act. You think about, put yourself in their shoes for a couple of minutes and see, oh, they look like they're from out of town, they're probably from out of town. Then respect that, and also think about their situation, where they've come from. So yeah, I think I'm done talking now.
Oh, there's a question.
Yeah.
Did you want to answer that now, Kaya? I'm taking over.
So we had planned to do the question time a bit later on after you present, Auntie Carey. Would you like to give your presentation now, Auntie Carey?
Oh, well, I've got nothing better to do. I may as well.
Oh, thank you so much.
I will mute me. Okay.
Okay, you can see my dog. Oh, hello?
Yeah, I can see the dog.
You can see my dog. Oh, that's the most important thing.
Very cute.
Very cute dog, because we are very much dog people here.
Yes, we are.
Thank you for that. I really love that Torres Strait Islander mob. And if you really want to support some of the Torres Strait Islander people, they've opened up a new business. Kerry Arabina has opened up a new business selling native teas, and we give those to our research participants. So, if you really want one, and if you can email me and tell me Mary's tribe, she calls it tribe, so that's okay, I will send you one. How's that for lucky ducks? So I just want to have a little conversation around how people research in Indigenous communities. And just before I do, I want to talk just 2 seconds about the Cambridge expedition that went to the Torres Strait Islands. It was a longitudinal research that went over almost a whole generation. And the findings for that were, Torres Strait Islander people are inherently stupid, and so don't waste your money educating them. And a lot of the Torres Strait Islanders, according to Nakata and his family, had internalized that, and they thought, well, I don't need to go to school, what good am I? And it just reinforces the damage that ignorant researchers can do to a community, because we know that Torres Strait Islanders you know, we owe our railway services to that mob for coming down and helping. So I just ask you to hold that in your mind. And, you know, who likes Cambridge anyway? So before you can do anything, we know that we have to create partnerships working with our communities. And it takes a long time to have an effective and productive community partnership. And so we'll just have a short conversation around your frameworks that you might want to use and your core value. Because if there's one thing we love, it's core values and that little baby Gujita there. So one of the ones that we use a lot around here is, because it's a Sydney-based language, is the Dillibag model. And this comes from my mother's language, or from Cadigal mob. And it just reminds researchers or people, anybody really articulating with community, what are the values really that you need to hold. Now, this doesn't mean that you can't use this wherever you are. It's not just a Sydney-based thing, but it means that you do things like you hold as a privilege when people tell you their story, that you recognise that it's the community or the consumers that actually have privileged you to come in to look at this whole project, for the whole project, not just the beginning. You have to hear what's said and what's not said, because sometimes people want to fill the holes of silences with something. And in a lot of our communication, silence is privileged and it's part of communication. So, you know, you don't have to think, you don't have to jump right in, although I've done that with my ADHD. So also then getting cultural assistance, and we'll talk about this a bit later too. So here you have to have an understanding of what cultural humility looks like and have that as one of your core values. You have to recognise that there's power in research, and the example that I used with the Cambridge expedition ruining Torres Strait Islander people's reputation was incredibly damaging for that whole group of people. So you need a core value of respect. The other thing is Bourbon Ghana is to leave the community in a better place, in a stronger place. So if you have skills that you can transfer across to that community, that's great. We like that. So, you know, stuff like that is really good. It's the 2-year tourists, the people that come up, get a degree of some sort and then bugger off and you never see them again. That's where a lot of people can be upset, and then they'll be, because we are the most researched people in the world, and sometimes we'll say we're over researched, and that can be distressing. So here you can see that we really think it's appropriate for you to maintain those relationships beyond the extent of the research. So, for example, we just did a metabolic clinic in our local AMS, and one of the questions asked of the doctors was, "Are you here for 2 years, or is this an ongoing thing?" He said, "No, this is my job. I'm here." So you can see that there's almost a reluctance to approach. So how do we consider this? So this little puppy's giving you a lick on the nose and telling you that the partnering cycle is probably just as, if not more important than what your research outcomes you want to be. That was dreadful English, sorry. So here the first part is scoping and building. So you can see that this part, this quadrant, can take a long time, because you need to get this scoping and building before you're even agreeing to partner with that organisation or community to do any sort of research. Yep. And things like building relationships and mapping and planning, that's where we're looking at that in Bathurst at the moment, to look at where they might need a new AMS, etc. These are the sorts of things that can take really, it shouldn't be like this equalised circle. We really need it to be a little bit different. To drop down to managing and maintaining, again, this is where you have your relationship as your key. reviewing and revising is very much things. This is where you're going to really look at the results that you get, and you're feeding this back to community all the time. And then you can write up, and then sustaining the outcomes means that you've shared the knowledge, acknowledge the community or the people that you've come from, and find a way to continually support or continually be engaged with that community. And then, you know, you can roll that out across the world, if you like. Thanks, little dog. Another way to look at it is this. So you can have this idea of coordination to identify what's at stake, cooperation, where you really want to see what's important for the community or the people that you're working with, and of course collaboration. And when you can do all that, oh, thank you. Well, that's pretty scary. And when you can do all that, then you have to consider then you've got that communication and trust. And how you get that is, good question. Let's talk about that now. So establishing a personal connection is all about relationships. So you need to have an understanding of the community, because you will only be successful if you have considered the community to be the boss of you. So you don't just go in and say, oh, I think like for example, there was we wanted to when I was working for the Commonwealth government, we wanted to roll out some sort of education program, you know, like the CDAP things in a particular remote community. But the elders there, the women and men, said, look, before we look at that, we need to look at our chroming program. You know how young people, it's horrendous the damage that you can do from inhaling the gases. And so instead of that, we rolled out the Opal program, or the Opal Field program. So it's good to think, oh, look, if we had education and working, because we know that increases everybody's health and social connections, but it wasn't what the community were really worried about. I mean, they were, but it wasn't their most important thing. So, you know, you might insist on doing your program and then not get the buy-in and the results that you want, and then you'll go away thinking, I'm never working with that mob again, they're too hard. And that's not necessarily the case. But what's the most important thing is consumers, consumers, consumers. So consumers are your community, and they're the key to you working well. So you have to remember reciprocity is really important, and have an understanding of who the cultural brokers are. And so, for example, if you want to do something in health, then you would go to the local health place or the hospital or health facility and find a liaison officer and talk to that person. In the same way that if you wanted to do something with community education, then you'd go to the school and ask to speak to the Aboriginal people working there. Like, these are your consumers, you know. So even though like, for example, we might be working in a particular role, we're all still part of the community that we live in. So, you know, we have a responsibility to that community as well as to whoever is employing us. But it's the consumers and community that are the key to doing anything in our spaces, I guess. The other thing is you have to be honest. So you don't have to be an expert in everything. There's only been one person on this planet who knew everything. And Kaya, who was that?
Do you mean me? No, I don't know who.
My mother, that's right.
Oh, yeah, sorry, I forgot. That's
forgot.
So true. Yeah, I'm sorry.
No, that's right. I still love you.
Okay.
So if you make a mistake, you say sorry and move on. You know, you don't have to know everything, but you don't gammon. I want to say bullshit, but I don't want to get into trouble for swearing. But don't gammon your way along. Don't pretend that you know everything. You know, it's okay not to know everything. Unless it's in your exam. Oh, sorry. You have to show up also, and you have to be present. So that's not necessarily a present, but you know, if you want to take whenever we go anywhere, and it's interesting that the team that I work with has really got this down pat. We don't always take presents, but you know, as I said, I will send you some island tea, native tea, non-caffeinated. We always over cater. People say, oh, why are you doing that? Like if we have 30 people coming, well, I know that Chris is going to organize for 50 or 60, because you won't get people to come and eat something knowing that they've got hungry kids at home. They won't come and eat a piece of cake knowing that their kids at home would love a piece of cake. So I always over cater, and it shows that respect to that community. So sorry about your budget there. So but be present. Don't take a present, but be present. So be listening and be attentive. We call it having generous listening. You might know it as Dadiri. It's where you really have an understanding of being able to sit with somebody and listen to them, and also share with them. And it's good for you and for them as well. Oh, sorry, that's dreadful spelling there. So you have to have regular catch-ups. So, and that means like sometimes you're going to not be able to go out to your community or have your community come in, and that'll be a thing called sorry business. So we know in one of our remote communities, we just took 2 of our people back because they had 4 deaths in 6 days. And then we are still really impacted by COVID as well. You know that in New South Wales, there's still 50, 60 deaths a week. So if there's issues coming along with your people turning up, then try and find an understanding of what that is. So it's not because they don't like you, and unless it is, I don't know, could be. But if it is, check it out, see what's happened. Like, for example, also around catch-ups, I worked in a community in Western Australia, and I was already so whenever I used to go to those remote communities, I'd take my truck and my swag, and then sometimes I would wait for 2 weeks at the boundary of that community for somebody to come and get me, because they need to know that you're coming. They need to know to set up for you. And if there's sorry business or personal business or stuff that they don't want outsiders for, you just got to suck that up, and wait for that. But to look at it from another way, I know that there was a girl who came from a young lady who came from one of the metropolitan universities, and she went into the community in her traveling truck, and then just parked under the tree in the shade. And you think, well, what's wrong with that? But that meant that the men couldn't go and sit under the tree in the middle of the day. They used to go and have their yarning sessions there. So it's just that being present, having an understanding of what your catch-ups are, where they are, and having some goals, which is important. And it's time as well. So I always say, if you plan to do 2 months field work in Indigenous community, it's going to take you 4 months. So you have to recognize that and just be aware of it, and be intentional, which I probably don't have to explain to people, but it means having an understanding of what you're doing and being really respectful of what it is that your goals are. The other thing I like is this privileging silence. So it's okay to have silence in community and in conversations, but it's also okay to reassess and realign to make sure that you're both on the right track, because you might have missed something at the beginning, or you might have not talked to a particular person or group in that community. So it's okay to be flexible and to realign and to have little puppy dogs. When you're all done, you have to disengage respectfully, but I think it's important that you stay connected, and that's for a few reasons. One, because it's good for your soul, but it's also good for that community, and it's good for the researchers coming after you. Like, some people have been connected still to their community. Like, I still go up to Columbaroo, and still send them stupid Christmas stuff, lights and stuff at Christmas. So do I get anything out of that? No, just knowing that this, yeah, sorry. So, you just stay connected to however it best suits you. But importantly, don't walk on eggshells. Sometimes the conversations that you need to have will be uncomfortable, and you need to have them. And that's called leadership. And if you want to be a researcher in our communities, you need to be a leader in what you're doing. So if if somebody's doing the wrong thing in your team, or even in the community, that not the wrong thing, but something that you think, "Oh, we're getting a little bit off track here," don't be frightened to talk to people, because that's called integrity, and people will respect you for that. Because that's also considering crafting your agreements. So I think you do have to have ground rules, but they do have to be flexible. You do have to be able to say, okay, this milestone might be a bit behind, but let's talk about why it's behind. And let's not panic when stuff's behind either, because we can fairly easily adjust things, and that's because right from the beginning, remember, I showed you that you have to consider the partnering cycle as something that you might need to go back to and adjust as you go. So really, that's it. But the most important thing for us is, well, don't ask, don't believe me. Let me introduce our mob to you.
What makes a good partnership with Aboriginal communities?
Respect.
Self-reflection.
Friendship.
Consistency.
Willingness to learn.
Trust. Trust.
Trust.
Aboriginal people often say that they are the most over-researched people in the world, and you come to think, why is this the case? That's largely because a lot of the research that's been done in Aboriginal communities often hasn't met the needs of the community.
A lot of people have no idea where to start when it comes to researching Aboriginal communities or ways to do it appropriately. What makes me passionate is being able to get the information out there so that we don't have this whole flood of research continuing to happen with Aboriginal communities that doesn't need to happen.
It's the community that knows best what they need to actually best benefit them.
It's really important that for non-Aboriginal organisations or non-Aboriginal people working with Aboriginal communities, they understand the importance of pacing their engagement and taking that time. And when you're taking that time, it's really about building an understanding of the community, their history, and importantly, their strengths.
A lot of this is actually achieved through building the relationships through yarning. So yarning is quite an informal, conversation. It's not just a matter of what you say in the meeting, but rather actually what you say outside the meetings, how you are with them, getting to know them.
I need to ensure that I'm trustworthy and I'm known. It's who you deal with in communities. It's important. You always speak to the elders. Then it trickle down to the other level within the community.
Respect Aboriginal leadership and to recognise that there needs to be proper governance.
Get an understanding from their perspective about what's driving their engagement and what are the outcomes we want to achieve as part of this partnership.
Working in partnership with Aboriginal communities around health, I think it's really important that we recognise that health and wellbeing is not just seen through that Western biomedical lens. It's really important to consider health in the holistic concept. So health for Aboriginal and Torres Strait Islander people is really about the physical, the social, emotional, the cultural and the spiritual health and well-being of not just the individual but the community as well.
In partnerships, it's important that leaders acknowledge that they don't know everything and they need to learn about their partners. They need to be open to new ideas and they need to respect the perspectives of their partners.
From my perspective of a non-Aboriginal person, what makes a really good partnership is listening to the community, building relationships with the community, and having that transparency to achieve the outcomes that you want together.
I think what makes a great partnership with Aboriginal communities is having a shared idea. If we can agree on a shared problem, a shared way of looking at the solution and working together towards that solution, that's when a project is successful.
For a good partnership with the Aboriginal community, at first, listen what people want in a partnership. What do they expect in the partnership? What outcomes they want in a partnership? There's a lot of things you look at that you want to make sure that partnership are level.
I think it's really important to be clear around what the word partnership actually means and recognising that that word can mean different things for different people.
Openness.
Mutual benefit.
Time.
Transparency.
And integrity.
Really, at the end of the day, it's about that mutual respect and trust.
I know we are the coolest. So just to recap, then it doesn't really matter what Indigenous framework you use, as long as you have an understanding of the requirements of an Indigenous lens, so you don't, what's the term, screw up like Cambridge did. So thank you. Don't forget, I'll send you a prize.
Thanks so much, Honey, Carrie and Mary. It was really good to hear from both of you about, Mary, your experiences across 3 different medical centres, and Auntie Carrie, I guess the models you developed, the dilly bag model and the partnership cycle, and how we can use that to inform our research. So thank you both. So now I guess we'll move into the questions, and please everyone place your questions in the Q&A, and Auntie Carrie and Mary can answer them for you. Let's see who we've got. We've got a question from Belinda. Belinda says, I think the underlying theme of Mary's conversation is a big warning that everyone needs to do more to maintain humanity in care, education, and research. I would love to hear if Mary and Auntie Carrie have any practical strategies for services, policies, and systems to maintain humanity in all they do. Who would like to answer?
I think what I wanted to end with is that everybody, like my topic is that everybody is different but the same. So as in every person, when you go to get a service, you expect service because you pay for that service, or that the organisation is set up there to give you that service. So when that service is not up to scratch, then people are going to walk away from that service. And that's been my experience, and I'm sure I'm not the only black fella who thinks like that. So what I would say is those organisations need to be fitted out with the right people to give the service that organisation, like an Indigenous medical centre, you can have non-Indigenous people working there, but they need to understand how Indigenous people work and think, and how to treat us respectfully.
Yeah, I agree. I know when you apply for a job in New Zealand as a nurse or any health professional, the first criteria is you have to demonstrate how will you meet the requirements of the Treaty of Waitangi in your practice, and yet we don't have anything like that here. But I do think that one way to make sure that your service is safe, respectful, and appropriate, and you have clinicians or practitioners or professional staff at any level that are culturally proficient, is to have a good understanding before people start of what your mission vision statement is. And I say you need unconditional positive regard. And an example of this is when the old men come in and they're painted up, and that they've been eating kangaroo and their kidneys just over protein and they're crook, then you can't say, you stink, uncle, well, old man, go and have a shower and come back then. Like, you have to look after people who smell bad, who swear badly, and who might not have this idea that they have to say thank you. Remember, there's no word for thank you. Like, if I give you a gift, it's me who should say thank you to you. In my family's culture, it's me who says thank you to you for accepting the gift that I've given you, not you thank me for whatever. So I remember going out to Mount Magnet, and the nurse there, who I really had to not punch in the face, and I still think that's one of my greatest, should be on my CV, because he said, don't expect anybody to say thank you here. Nobody will thank you. And you think that's, if you need your patients or clients or lucky punters more than they need you, then it's time for you to go and have a little rest and work in Kmart. Just so.
I can't see any more questions.
Yeah, there's a question in the chat.
Oh, is there? Yeah.
For Mary.
Let me just find it.
Is there
There's one that says, it sounds like, oh no, I'm losing it. It sounds like allowing enough time for conversations is important. Do you think that short appointment times and schedules are something that researchers should be especially aware of?
Yes. Because it takes a while to build trust, doesn't it? You know, trust is the speed of light. Like, it takes a long time to get there. Then you can turn the switch off and you're done, you know, and they're not going to come back to you. Even if that, like, I remember going into the doctors and she said, I said, oh, we took some blood. I said, oh, will you let me know if I need to come back? She goes, oh, no, it's your responsibility to come back. And I wanted to say, like, no, other places will ring you up and do a callback, but she wanted me to take like half a day off work, go and sit there for 2 or 3 hours. Not that I minded, because it's good catch up for community. And then she'll come and say, no, you're right. You know what I mean? Like it's, I think, oh, I'm not going back to you. There's no trust there, you know.
And a lot of the times it's the I know it's the way that you're supposed to do business, like, you know, at a surgery or something, or at a medical center, they've got 15-minute appointments and stuff like that. But when you're dealing with Indigenous people, some of us might take a long time to get to the point of our conversation and our problem. And if you don't stop and listen to what they're saying or listen to what they're not saying, then you're never going to get to hear exactly what people are thinking, because they will talk. Our people have this thing of talking around exactly what they want to say. So when you've had a bit of experience sitting in meetings or sitting with people, you'll finally hear the point will come out, you know, and not in the first 5 minutes, or not that, you know, we're here now, let's talk about this. No, it doesn't happen like that. You got to wait for them to feel comfortable with you and what you're looking for. And that will happen if you sit and take time and share your story, as in, even as a researcher or whoever you are from a different nation, whatever, tell people your story, because that brings humans together.
That's lovely, Mary.
Yeah, and so true as well. There was another question, I think, for you, Mary. If you wanted to answer it, can you elaborate a bit more on what the non-Indigenous doctor did to make you feel unseen, and some recommendations for how this can be improved? Is that something you would want to feel comfortable talking about? Or?
Of course, yeah. I just, you know, like we were just saying there about the 10-minute, 15-minute time that they have to spend with a patient. That's not how our brains work, or us as people. We expect to sit with people for a while, for them to get to know us. Even as a doctor, there was no two-way conversation. I said, I mean, I was just there to get my scripts refilled, but he didn't even listen to my previous history. And then he gave me back my script, and then he did do it. He said, like, yes, I'll do that for you. He did it, but he didn't complete my scripts properly. So I walked away with one of my medical dosages not completed. I then had to go and follow that up. Now, if that was somebody who is just not aware of those sorts of things, they might not have figured that out for a long time, you know. So when I went out, I was looking through it and I was like, oh, hey, missed this script. Walked back in there and I said, I need to see that guy again because this. And some people wouldn't have the nerve to walk back in and do that, you know, just sort of like, they'd be like, oh, all right, come back and see him later. But you learn I've learnt, if you don't speak up now, and I've been in not in situations, but, you know, you work around people, you ask questions straight away. You know, otherwise your meeting's over and that's it. No more talk. So yeah, I think so many situations, but even as a Torres Strait Islander going into an Aboriginal community, we have our own, what's the word? You need to introduce yourself properly. You need to talk about, I need to talk about home. I need to talk my connections to the country where I'm at, if there is any connection there. People then will sit and be a little bit more, give you an ear. So, you know, opening yourself up, like basically leaving yourself, telling about you so that they can go, oh, okay, you know. And I've had that very similar experience happen when I was on a community as a representative from the university. And I actually grew up on the other side of the mountain to this community, and I'd never been there as a child because it was an Aboriginal community, and me as a Torres Strait Islander, us as a Torres Strait Islander family, didn't have any reason to go there. But when I went there for work, I explained that to them, and I said, oh, funny, I grew up over the other side of the hill, blah, 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 blah. These two like proper TOs of that community were sitting there. And as soon as I said things like that and explained who I was, their ears pricked up and they moved closer to the table. And after the meeting, they came over and spoke to me, which I just like blew me away because I just didn't even realize what I'd said. And then when I said it, I saw them react straight away. And then I realized that, oh, I should have done that right in the beginning, but that's okay because they came and spoke to me after that. It was good. They were waiting for the special words, I guess. Did I answer that question? Hopefully I answered that.
Yeah, no, that was really good. Definitely. Have a look. What else do we have? We have another question, I think, or a comment. The consultation system through Medicare has a lot to answer for. Conveyor belt approach that does not understand the nuances of human interaction and the need to build relationships. There was another statement from Karen, or question. I'm not sure what it was about. What was the statement about unconditional? I'm not sure. Sorry.
That's unconditional positive regard. It's a Jungian thing, yeah. And it means that you have to look after and treat all people, like Mary says, with, you know, as people, unconditionally, whether you stink or whether you are ugly or whether you're fat, you still got to love them.
Another person in the chat says, I am Indigenous, I have a master's degree, and in my experience, interviewers assume I'm uneducated and stupid prior to speaking to me. So that, yeah, that's something that also happened.
But you know, I was in the ED of the local hospital up here, and they because it's on your Medicare card, so you swipe in and they go, oh, you're Aboriginal. I went, yeah. And you know, you're waiting for it to say, oh, you don't look at no, but they didn't. They said, do you need an interpreter? And I went, oh no, I actually work at the university. And they said, what, in the food court? And I went, I'm trying to get a job in the food court, you know, working up to the food court, because they wouldn't think a professor would be an Indigenous person. Yeah, it was pretty funny. I got a lot of traction out of that.
Oh dear. Yeah, that happens, doesn't it? So another person said, is it a good idea for a non-Indigenous researcher to do some acknowledgement to country when they meet with individuals?
Good question.
When the individuals?
Yeah, it says individuals.
Like what, when you walk up to Mary and you go, hi Mary, I just want to acknowledge the I'm a bit confused.
Yeah, probably more so like, I don't know, group meetings and events.
Oh, is it appropriate for non-Aboriginal people to do it?
Yeah.
I prefer non-Aboriginal people to do it.
So do I, because I think about country I'm on all the time.
Yeah.
Sorry, it's not my webinar. It's
no, it is.
You two and I'm butting in.
It's all part of the. Michelle Halliday's online. We should hassle her.
Yeah, Michelle, hit us up with your questions. Anyways, I've just realized it's time to close. It's 2:55, and I'm really sorry to everyone whose questions we haven't answered yet. But thank you so much, Auntie Carey and Mary, for sharing your knowledge and experiences with us today. It was very valuable for me, and I'm sure the audience as well. And Auntie Carey, I use your models in research and I can vouch that they're great and are really good. And yeah, so thank you both so much. And just on closing the webinar, the recording will be available on the YouTube channel. I shared the link in the chat, so that'll be available within the week. And also, pretty please, could you do the evaluation survey, which will come up on your screen upon exiting Zoom. And that is all for today. So thank you, thank you, thank you.
Thank you. Lovely to catch
you.
up, Mary. Thank you, Kaya.
Thank you very
Great work.
much.
Thank you,
Well
Laurel.
done.
Yeah, thanks,
Yeah.
Laurel. Thanks. Bye.
Bye.